Hello, my name is Jody Siegel, and I'm Director of Education for Alyssa's Mission. On behalf of my two co-presenters, Katie Baker and Dana Gritters, whom you will hear from shortly, and myself, we would like to welcome you to this recorded parent presentation. We know that suicide is not an easy topic, but it is nonetheless an essential one. Suicide among our youth is a very real concern. However, suicide is also preventable. The best way to prevent a suicide is to educate those in your child's life, their friends, teachers, you, parents, about the warning signs and what you should do in the event that you're seeing these signs. Thank you for making your child's mental health a priority and for taking the time to learn how best to keep your child or another teen in your life safe. Alyssa's Mission is a nonprofit organization based in Northbrook that was started by a family that lost their daughter, Alyssa, to suicide in 2004 when she was just 16 years old. Alyssa's family quickly realized that her friends had a lot of information about her that they were unaware of. Alyssa, for example, was cutting herself, using drugs and alcohol, and most significantly, telling her friends that she wanted to end her life. Alyssa made her friends promise not to tell, and wanting to be good friends, they kept her secret. Alyssa's parents in no way blamed her friends, but this is what motivated them to start educating school communities about the warning signs for depression and suicide. We fully fund and help schools implement an evidence-based suicide prevention program, SOS Signs of Suicide Prevention Program, which we'll talk more about later in the presentation. We currently partner with over 100 Chicagoland middle and high schools in order to educate students, staff, and parents in suicide prevention. Our plan today is to first very quickly review some current statistics on youth suicide, and then discuss risk factors as well as what signs should warrant your attention. The goal being to help you distinguish between normal teenage behavior and behavior that requires prompt action and intervention. We will review specifically what your role is and how to best, proactively and reactively, keep your child safe. This will include information on how you can access community supports, including hospitalization, in the event that this is deemed necessary. Finally, we'll provide a brief overview of the SOS program that we bring into schools, so that you have an understanding of what your child will experience, assuming their school partners with Alyssa's Mission, or if not, a program that you can help advocate for in your school community. According to the CDC, suicide is the second leading cause of death among young people ages 10 to 34. More than 4,600 youth lives are lost to suicide each year. Suicides also are often underreported. Many so-called accidents are often in fact suicides. On top of this, it's estimated that for every completed suicide, there are at least 25 attempts. And I've seen statistics much, much higher, that really as many as 100 or more attempts for every completion. So when you factor those last two items into the mix, youth suicide is an even bigger concern than what the statistics reveal. The Youth Risk Behavior Survey is a national survey that's conducted by the CDC that looks at priority health risk behaviors among teens. Teens in grades 9 through 12 are surveyed through their schools on a range of different topics. So drug use, healthy eating habits, bike safety, etc. There are also a number of survey questions relating to depression and suicide. The most recent results are from 2015. The national statistics are here in black and the Illinois statistics appear in red. As you can see, over 14% of teens nationally and in Illinois reported that they made a suicide plan in the past year. Most alarmingly, 8.6% of teens nationally reported that they actually attempted suicide one or more times in the year preceding the survey, and even higher than that in Illinois, almost 10%. Clearly, suicide is not only a concern nationally, but also in our area. I want to talk briefly about depression, because depression is the leading risk factor for youth suicide. About 10 to 15% of teens have some symptoms of depression at any given time. Before adolescence, depression is equally split between boys and girls, but beginning around age 13, more than twice as many girls are depressed. Finally, 11.4% of teens, so 1 in 9, report experiencing at least one major depressive episode in a given year, and that's the most common type of depression. There's a myth that teens can't become depressed, that they're just being moody or being a teenager. But as I just mentioned, 11.4% of teens experience diagnosable depression. That is why it's so important that those in teenagers' lives, parents, educators, etc., are able to help distinguish between what is typical teenage behavior and what is behavior that warrants further investigation. As I mentioned earlier, a major depressive episode is the most common type of depression. You will note that in order for someone to be diagnosed with depression, and that diagnosis must come from a mental health professional, they must have 5 or more of the listed symptoms. On top of this, these symptoms have to represent a change from their previous level of functioning. As you can see, depression is more than just feeling really sad. One's mood is certainly affected, whether it be a depressed mood or, as more commonly the case with teenagers, irritability. But on top of this, depression affects all parts of a person's life: their mood, their energy level, their thought patterns or behaviors, how they're feeling physically. The most serious symptom is clearly the last one: suicidality. This symptom is most likely to emerge if depression goes untreated. In children and teens, an untreated depressive episode can last 7 to 9 months. That's an entire school year. Just think about how much the academic, social, and emotional growth of your child would be hindered if they had depression and were not getting treatment for it. On top of this, more than 90% of teens who complete suicide have a diagnosable mental health disorder, most commonly depression. So logic speaks to the fact that if you want to prevent suicide, you need to help identify those teens who have depression and get them linked to services and treatment. Whenever there's a suicide, the first question people ask is why? Why did they do this? Why did this happen? Even though the media often attributes suicide to one specific factor, for example, being bullied or being gay, rarely is there just one cause or reason. In the majority of cases, suicide is the result of a combination of risk factors in the presence of one or more negative life events. A risk factor is any personal trait or environmental quality that's associated with suicide. A precipitating event is that trigger we often hear about when suicides are reported. For example, bullying, a breakup, getting suspended from school. Typically, multiple risk factors in conjunction with that trigger are involved. Before I review risk factors, I want to briefly talk about the teenage brain. As you can see, the teenage brain looks different from an adult brain. Most significantly, the part of the brain responsible for reasoning, controlling impulses, and planning ahead is the last section to mature. So teens are often not capable of thinking through situations or problems in a complex way. They live in the here and now and are affected greatly by what's happening in the moment. A big test at school, a fight with friends, a breakup. Teens are impulsive and often act without thinking through the consequences of their actions. When you couple this normal brain development with depression, it helps you understand why suicide might appear a viable solution to a problem. When talking about the risk factors for teen suicide, it's easiest to group them into different categories. The first is behavioral health. You'll note that the first 3 items listed in this category, depression, substance abuse, and previous suicide attempts, have an asterisk next to them. This is because they are the 3 leading risk factors for youth suicide. Non-suicidal self-injury is also listed in this category. This is when someone hurts themselves on purpose, oftentimes by cutting. In most cases, someone who is doing this is not trying to kill themselves, but is doing so as a way to help deal with strong feelings or emotional pain. However, they might accidentally kill themselves, and minimally, this is clearly an ineffective coping tool and a risk factor for suicide attempts down the line. The next category is personality characteristics. These are characteristics of the teen himself or herself that increase their likelihood of a suicide attempt. For example, someone who has low self-esteem, poor problem-solving skills, someone who isolates themselves from others, is impulsive or aggressive. They are at higher risk. The next category is adverse life circumstances. Basically, when something really bad happens to someone who's intensively bullied, for example, or who has had academic or behavioral problems at school. As I mentioned earlier, due to the nature of the teenage brain, teens deal with stressors differently from adults. Even a seemingly small incident, like a falling out with friends, for example, can be a big deal to them. Instead of rationalizing as adults would do, that they can work the problem out later or that they have other friends they can turn to, that one seemingly small incident, especially in the presence of other risk factors, impulsivity, depression, etc., can seem insurmountable, sometimes becoming a trigger for suicide. Keep in mind that in most cases with a suicide, there are multiple risk factors at play, both within and across these different categories. As parents, it's important that you're aware of what the risk factors are. so that if they are present, especially when there are more than one, you will know to be more watchful of your child. The next category is family characteristics or stressors. So for example, a parent who has lost his or her job, parents who are going through a divorce, a family member who's seriously ill. Finally, environmental characteristics, including access to lethal means, particularly guns. Half of all suicides involve firearms, and they are the most lethal method. Because of teens' impulsivity, they're much more likely to act upon suicidal thoughts if there's an identifiable means to carry this out. Guns in the home increase the risk for suicide, whether someone has a mental health disorder or not. If you do have guns in your home, make sure they are stored unloaded in a locked cabinet. Ammunition should be stored separately in another locked container. Research supports that reducing this access will significantly minimize suicidal risk. I also want to briefly highlight another risk factor within this category: lack of acceptance around LGBTQ issues. Teens who are lesbian, gay, bisexual, transgender, questioning are 4 times more likely to attempt suicide compared to their heterosexual peers. Furthermore, if they've come out to friends and family and are not accepted, they're 8 times as likely to attempt suicide. In addition, the majority of LGBTQ teens report being harassed at school and feeling unsafe. If your child or one of your child's friends has identified himself or herself as LGBTQ, or if you suspect that they're struggling with their sexual identity, the more communicative and supportive you can be with them, the better, especially if other risk factors are evident. Alarmingly, 80% of youth with mental illness are not receiving services. As I mentioned earlier, the best way to prevent suicide is to identify those teens with signs of depression and get them linked to needed treatment and services. This brief video clip touches on some of the warning signs you should be aware of as parents. I want to acknowledge that with all of the clips we'll be showing right today, there's a brief time delay. However, since the material is so important, we still wanted to include them.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy. I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual,
Acting really down, crying all the time for no good reason,
or getting really mad, not able to sleep, or sleeping too much,
Shutting her friends out or giving her stuff away.
acting reckless, drinking, using drugs, staying out late,
Suddenly not doing stuff he used to love.
or doing stuff that's just not like him.
it might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed. Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself. It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
As parents, you should always take notice if your child is acting differently, if there's a change in their behavior, a change in their personality. You may remember from an earlier slide that one must present with multiple symptoms in order to be diagnosed with depression, and that these symptoms must last 2 weeks or longer. I'm not going to read all the symptoms listed here, but you should note that even though most of us associate sadness with depression, with teens, a lot of times depression doesn't look like sadness. It looks more like the last item on this list, someone who is angry, grouchy, or irritable. As mentioned earlier, depression typically affects all parts of someone's life. You'll note here that depression often involves physical symptoms, like increased headaches or stomach aches, or changes in eating or sleeping habits. Also, school performance is often affected, including an inability to focus, lack of participation, incomplete assignments, drop in grades. Drug and alcohol use, as well as risk-taking behaviors, are also red flags. The last 2 slides primarily covered signs of depression. In order to warrant your concern, you would be noticing multiple signs over a period of time. This next slide covers specific signs of suicide. These things would only need to happen once in order to warrant your immediate concern and action. The first is talking or writing about suicide or death. If someone talks about killing themselves, either directly, such as I want to die, or indirectly, for example, my family would be better off without me, you should always take that extremely seriously. This could also include writing it, so either in a note, an email, a text, a post. Whether someone says it or writes it, it means they're thinking about it. You should never assume they're just joking or just being dramatic or attention-seeking. Next, someone neglecting appearance or hygiene, especially if they previously cared about and spent time on how they looked. For example, not showering, wearing the same clothes several days in a row, girls no longer wearing makeup. Other serious signs include isolating from friends and family, obtaining a weapon or other means of self-harm, giving away prized possessions. So Alyssa, for example, started giving away her clothes and her jewelry in the days before she died. And also dropping out of school, athletic, or other activities, especially if there is no definable reason. One last noteworthy sign is someone who exhibits a sudden and unexplained improvement in mood, especially after a significant amount of time of seeming down or depressed. While you might assume this is a good thing and think perhaps they're getting better, it could indicate just the opposite. People who contemplate suicide in most cases do not want to die. They're just looking for a way to escape the insurmountable pain that they're experiencing. If that person then identifies a means to end that pain, so they come up with a plan to take their life, they often feel a sense of relief. That relief may manifest itself as happiness, and/or they might suddenly seem like they have a ton of energy. If you observe this, especially in someone with known depression, you need to take it extremely seriously and take action right away. When trying to determine if the signs you are seeing constitute normal teenage behavior or something more significant, it's important that you look at the frequency of the behaviors as well as the extremity. In those first two slides I just reviewed, someone would have to be demonstrating multiple signs over a period of time, 2 weeks or longer, in order to warrant your attention and response. With that last slide I discussed, that's where extremity comes into play. Only one of those things would need to happen and only one time in order to prompt you to take action immediately. You'll hear more about what that action should look like later in the presentation. Right now, I'd like to turn things over to my colleague, Program Director Katie Baker.
Thank you, Jody. Now we will cover, as parents and community members, what you can do to keep youth safe. The great news is that even when someone has risk factors, if protective factors are present, they can reduce the risk of suicidal behavior. Protective factors are personal traits or things in someone's environment that can reduce the risk of suicidal behavior. It is so important for kids to have healthy, loving, supportive relationships with family members in the home. So even if things aren't going well at school for the youth, such as they don't feel like they really fit in or they're not getting good grades, if they can come home to a loving and supportive environment, it can truly act as a buffer and protective factor against suicidal behavior. We talked earlier about how a young person's personality style can put them at risk for suicide. For example, someone who is isolated, has poor self-esteem and poor problem-solving skills, is at an increased risk for suicide. On the flip side, someone who has high self-esteem, good coping skills, seeks help when needed, and is open to new knowledge, their risk for suicide is reduced. Social connection with peers inside and outside of school is a key protective factor against suicide. The more enmeshed a youth is in different activities, both in and outside of school, such as sports, clubs, religious youth groups, the less likely they are to make a suicide attempt. We also know that one of the most significant protective factors for youth is a caring relationship with an adult. That could be someone in the home, such as a parent, an aunt and uncle, a grandparent, but also a teacher or another adult in their lives. Now we are going to talk more about how you can help your child if you notice some of the warning signs for suicide. One of the hardest things for parents is to know what to say to their child or how to bring it up. Here's a short video clip with some basic suggestions.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said something.
I wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself? It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask. They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask. In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
Often parents are very concerned that if they ask their child if they are thinking about suicide, this will somehow put the idea in their head and make them more likely to attempt. This is not true and is a myth. In fact, asking directly, are you thinking about suicide, serves as a protective factor because your child knows now that they can talk to you about this and they might be more willing to get help. However, there are some very important things that we don't want to say if we are concerned, and this next video clip highlights a few.
Here's what you don't say.
That's crazy.
Don't be such a drama queen.
You're making too much of this.
That boy's not worth killing yourself over. That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself.
We will talk more about how to respond to your child, but first, let's go over some important parenting tips. We all know how important it is to have regular check-ins with our children. The importance of listening cannot be underestimated. As parents, it's very easy to want to offer guidance and advice, but sometimes you gain so much more by just listening. As we already know, talking or writing about suicide is a critical warning sign. It's important to monitor your child's schoolwork for themes of death, extreme loneliness and sadness, statements about not being good enough or unworthy, even passive statements of suicidal intent, such as people would be better off without me, or soon you won't have to worry about me anymore. In this age of social media overload, it's critically important to have a handle on what your child is doing and experiencing on these sites. A recent survey by the CDC found that almost 15% of students said they had been electronically bullied, and we know bullying can be a risk factor for suicide. Sites such as Snapchat are popular with youth because the posted content disappears within 20 seconds, but that is plenty of time to hurt someone's feelings. With sites such as these, it is important to discuss proper social media etiquette with your child. What is okay and not okay to post? Young people need to know to not friend, chat, or give out personal information and passwords to someone they don't know, keeping in mind for online predators. You want to know exactly what social media sites your child is on and join these sites to monitor. As a parent, you have a right to your child's passwords and to be privy to all social media content and phone texts. If you notice your child has been on social media and they are upset, inquire about what happened. Also, technology should have boundaries with specific times for use. Something very scary nowadays is that fake apps exist. There is an app that can be downloaded that looks like a normal calculator, but actually it hides secret photos, videos, and notes once a password is typed in. Check your child's phones for this. Check also for apps such as Keepsake and Vault, as they again are ways for teens to hide content they don't want anyone to see. It's important to continue to educate yourself on this topic. Check out netsmart.org and commonsensemedia.org for more information. So now back to what to do if you notice warning signs in your child. Here is how you can help. This is easier said than done, and you may be feeling upset or nervous, but you want to do your best to remain calm. If you become escalated and excited, it can cause your child to become this way, or even shut down because they feel they have upset you. Ask them directly, are you thinking about killing yourself? Are you thinking about suicide? Listen without judgment and don't minimize their feelings. Comments such as, you are just trying to get attention, or how could you be feeling this way? You have so much going for you, are not helpful. You could say, a lot of people feel this way and we need to get you some help. It's important to ask if they have thought of how they would attempt suicide. Individuals who have thought specifically of how they would do it and have access to the means to carry out their plan are at greater risk for attempting suicide and need help immediately. You want to make sure the child you are worried about has constant supervision until you can get them to help. Maybe that means staying home from work that day or taking your child to work with you. Remove means for self-harm, such as firearms, sharp objects such as razors and knives, bottles of pills, and even alcohol, as we know this can be used to self-medicate, which can make your child more impulsive. Your child's school is a great resource. The social worker or counselor there can direct you to mental health resources in your area. Alyssa's Mission website lists many local hospitals and agencies, including inpatient and partial hospitalization programs. Just look under the Resources tab. Remember, if there is an imminent threat, meaning your child is expressing suicidal thoughts and/or has an identifiable plan in place for how they would attempt, you must react immediately and call 911 or get them to the nearest emergency room. It truly takes a village to raise a child. We all have to be watching for warning signs, and not just in our own children. You might notice them in your child's friend. Ideally, you would contact their parents to inform them of your concerns, but if this is not possible, you can reach out to their school or even call 911 if necessary. Now I would like to introduce Dana Gritters, Director of Emergency Services for Hartgrove Behavioral Health System in Chicago. She is going to talk about where to get help for your child and briefly what that might look like.
Thank you, Katie. It's always important to know when and how to get help when you're in a mental health crisis. Reasons that you should call 911 over driving to the nearest emergency room include violence, a reported overdose or ingestion of some substance or poisoning, intoxication, bleeding that will not stop, an attempt to hang yourself. If your child or loved one is in imminent risk, please go to your nearest emergency room or call 911. In the event that you call 911, be prepared to remain on the line with the operator and be as detailed as possible in describing your crisis. Be prepared to have the police, the fire department, and ambulance on scene to assist in your crisis. Be prepared that you will be transported to the nearest emergency room, and that may not always be the hospital of your choice. If you have a child, adolescent, or an adult up until the age of 21 with Illinois Medicaid or Managed Medicaid plan, you also qualify for SAS, which is a screening, assessment, and support service. There is no cost to this service for you. To report a mental health emergency, please call the CARES hotline. It's an operation 24/7, 365 days of the year. The number is 1-800-345-9049. The CARES operator will then document your crisis, collect demographic information, and link you to the home SAS agency nearest to you. Depending on your crisis, the SAS therapist may be able to provide you with a home-based assessment. They may direct you to call 911 or go to your nearest emergency room. The SAS therapist will provide you with a recommendation regarding your current crisis upon completion of a mental health assessment. They will then provide you with 90 days of home-based services at no cost to you. The CARES website will also provide linkage information to assist you with ongoing medication management and evaluation services. If you have insurance coverage through a private plan, you should go to your nearest emergency room or call 911. If you go to the nearest emergency room, please bring your photo ID and your insurance card. Be prepared to go through a medical clearance process prior to being screened for your mental health recommendations. The intake and treatment process can vary depending on your location, but be prepared to discuss your crisis and where the appropriate level of care will be recommended to you. If your child cannot be safely stabilized in the community, an inpatient hospitalization may be required. Be prepared to allow your loved one to remain at the hospital for crisis stabilization and treatment. This is typically 5 to 7 days at most inpatient facilities. Ask for an orientation packet, become familiar with the treatment and the visiting hours and additional information that facility provides. Be prepared to participate in your child's treatment and discharge planning. You are your child's biggest advocate. Comply with all discharge planning recommendations, intensive outpatient services, or partial hospitalization services, or outpatient therapy recommendations. Also, please comply with the discharge recommendation regarding medication and the follow-up services. Tips and recommendations. If you or your loved one have been diagnosed with a mental health issue or concern, it is always good to know the following. Understand all the resources that are available to you in your community, including specialty services that various providers may have. It's also a good idea to touch base with your insurance carrier to see what additional services and resources are in your network. Have your insurance information, picture ID, medication list, and a medical history available. Be patient. Know that the appropriate assessment, referral, and linkage all take time, as does working towards being more healthy. I would like to now turn the presentation back over to Katie Baker, Program Director, to talk about what schools can do for suicide prevention.
Thank you so much, Dana. We appreciate all of your insight. This next part of my presentation will review the SOS Signs of Suicide Prevention program, which most likely your child is participating in, and why you were directed to this presentation. We want you to understand more about the program and its components. It's important to note that your child's participation in this program requires parent consent. Most schools use a passive model that requires parents to opt out if they don't want their child to participate. A form may have already gone home to you if your school is partnering with Alyssa's mission and your program dates are approaching. SOS is the only school-based suicide prevention program that's listed on SAMHSA's National Registry of Evidence-Based Programs and Practices that's shown to address suicide risk while reducing attempts. Several research studies done on the program have shown a reduction in suicidal behavior with program participants, and a research study done in 2007 on the program showed a reduction in suicide attempts by 40%. The SOS Signs of Suicide Prevention program decreases suicide and attempts by helping students understand more about depression. They learn that depression is a medical illness that requires treatment from a professional, just like any other illness you would see your doctor for. The program capitalizes on the fact that when adolescents struggle, they will typically confide in a peer first before an adult. Students are taught that if they notice warning signs for depression and suicide in themselves or a friend, that it is okay to tell a trusted adult. Students learn that suicide is preventable and often the result of untreated depression. They learn that depression is a treatable illness. The program provides students with a specific action step they can take if they are concerned about themselves or others. Students learn the ACT help-seeking message. The acronym ACT is repeated throughout the education portion of the program. Students learn to acknowledge to their friend if they are seeing signs of depression and suicide, and to let their friend know they care and are concerned about them, but that the best way to get their friend to help is by telling a trusted adult. We review trusted adults in the school building as well as outside of school. The program begins for students with an educational video and discussion. The middle school video is called Time to Act. There is a separate high school video called Friends for Life. Both videos contain age-appropriate vignettes that reinforce the ACT help-seeking message. Students are engaged in a discussion about the warning signs they are seeing and how they can effectively apply the ACT message. After students complete the video and discussion, they are asked to fill out a screening form. This is the brief screen for adolescent depression. You will notice that this is entitled for high school on your screen, but the screener looks exactly the same for middle school and asks all of the same questions. The screener is not diagnostic in any way, but rather asks questions about the potential presence of symptoms of depression and alerts school staff to which students need further follow-up. Students are told that this is a survey and that only school mental health staff will have access to these results. Students are also given a response card where they can indicate whether or not they would like to talk to an adult at the school about themselves or a friend. Based on how students score on the screener or what they indicate on the response card, they will have a follow-up interview with a qualified school mental health professional or a community mental health partner that is assisting on program days. These interviews determine what, if any, services might be needed. A phone call will go home to the parent of any student that is met with that is in need of services or has any pertinent information that needs to be reported to the parent. We collect cumulative data across all of our school partners to show program effectiveness. Our data across the past 2 school years shows that, on average, 15% of high school students and 12% of middle school students going through the program were identified for follow-up interviews due to how they responded on the brief screen for adolescent depression and/or student response card. Approximately 50% of those students were ultimately referred for some type of service. Many of these referrals were truly life-saving. We hope you have found this presentation to be informative and helpful and that you feel encouraged to speak openly with your child about their mental health. Be sure to check out our website for more information and resources for parents on this topic. If you are watching this and your child's school does not currently partner with Alyssa's mission and would like them to, please contact us with your school social worker's information. Here is Alyssa's mission's contact information. Please feel free to reach out with any questions. Thank you so much.